Mr. Barr, if he has any questions.
Thank you, Mr. Chairman, again, and Dr. Moll, thank you for your your testimony here today. Just to further explore where the VA is specifically with its research on medical marijuana and cannabis. I understand your concerns with the proposed legislation in this hearing, that it's too prescriptive, and I note in your testimony that you would advocate, or the VA would advocate for smaller early phase controlled clinical trials with a focused set of specific aims that are warranted to determine initial proof of concept for medical marijuana for a specific condition. And I appreciate the chairman's overture to work with the VA on what the right framework should be going forward on this. My question is, you heard the testimony from the earlier panel, some of the VSOs and the frustration with the delays or the concern that this might slow down the process. What could you reassure, how could you reassure the committee that if it was structured in a way that meted the criteria, that it wouldn't slow things down?
Well, I think the first thing would be that the VSOs have to be at the table when we're having conversations about a research plan and what a full research portfolio would look like. So I would start there. There needs to be engagement. We need to educate each other on what each other's expectations are, and then set what those expectations would be for that research plan. I think some of the times we kind of crosstalk each other in terms of trying to explain what's involved, whether in a research type program, and I think we just miscommunicate, and we need everybody at the table from the beginning on this.
Well, again, can you provide an update on this the specific research that is ongoing now? If there's not a broad-ranging clinical trial that's going on, what specifically is happening?
So what I can comment on is the one study that is actually looking at cannabidiol in combination, and it's a double-blind, placebo-controlled study. It's actually out at UC San Diego, and they just enrolled their first patient last week, and they have a number of veterans lined up who wish to be involved in the clinical trial. And so that is really our first one that's being done specifically for PTSD, taking the standard of care and then determining whether or not there's an impact by having cannabidiol in that standard of care treatment plan.
And that interests me because, as you say, it's cannabidiol. Right. So it is, what is being tested is basically hemp. It's low THC.
Yeah, it's the refined available product that was previously mentioned by Dr. Grant.
Okay, or I suppose CBD could also be derived from marijuana, but there's no THC in it, or low THC in the substance that's being tested.
That's correct, sir.
Okay, so that's the baby steps approach, I guess, on this.
Right, and I want to point out that this is the one that is funded by VA. There are other VA researchers that are getting funding from other sources, as well as other university researchers and so forth that are looking at this. So I think when we're trying to assess what sort of work is going on out there, I think we need some sort of catalog or something to understand all these different studies, so that when VA comes up with, here's the portfolio we're going to do, it actually complements what else is going on. Sorry.
Doctor, are there any preliminary findings so far with the CBD and PTSD?
No, they just started enrolling patients.
Okay, very good. Final question. Could you describe some of the risks of requiring the training of VA providers in the use of medical cannabis in light of the fact that it remains a federally scheduled substance?
I'd have to defer to our colleagues over at Department of Justice and what they decide they want to prosecute or not.
Yeah, I guess the reason, what motivates that question is some of the other legislation that's being considered here today on training. It appears to put the cart before the horse. I think we do need to come to a consensus on an expedited, good, thoughtful, research-driven, evidence-based approach to research. But training VA providers before we have all the the evidence in seems a bit premature. So with that, Mr. Chairman, thank you, and I yield back.